I want to talk to you a little bit about you in the final page of the testimony that I saw from you in regards to mental health. I really find it very interesting where you get into psychotropic drugs and things like that, and how much we give this to people. And in particular, I'm concerned about the amount of psychotropic drugs that are given to boys in like 6, 7 years of age in kindergarten, first grade, to control their behavior, and I believe it's rewiring their brains. Now, I don't have scientific evidence of that, but I think we should be doing some research in regards to it. Tell us what you think are some solutions for that could be helpful to prevent some of these shootings that happen as a result of mental health breakdowns.
That's a great question. I do, and I'm not a doctor, and that is a deep, deep well that you just dove into. But I do know that when you tell me that there are black box warning labels and that it causes homicidal and suicidal tendencies, that's pretty much a no-brainer as to why don't we look and do some studies as to how these drugs are affecting our kids and even our adults. So I would like research in that area.
Do you, have you not found much research? Because I haven't either, and it seems to me it's something that there should be, you think about the National Institute of Health and how they've squirreled or I can't use that term here at the dais, how they've wasted money, the American taxpayers' money. It seems like something like this would be a really good research project, especially at some leading universities around America. I mean, isn't there much more research that needs to be done?
Well, and I'm glad that you brought that up, because just like it seems like there's one-sided research in several different areas, not only in the mental health and how it affects guns, but also just the gun-related deal. Because the CDC did do a study in 2013, and the numbers that this saves, that's what's missing from this conversation, is that the number of 48,000 deaths annually from firearms-related causes is a horrible number. But you guys are leaving out the conversation, the number of saves. That study, I think it said 3 million, up to 3 million saves annually. And if we're gonna look at apples and apples, yes, 45,000 deaths is terrible, but when you compare that to the 3 million that it saved, we should be having that conversation as well. It's disingenuous.
Yeah, thank you in regards to that.
And it's scrubbed from the CDC.
and Mr.
It's no longer there.
Yeah, and Mr. Chairman, I think that we should be following up with the administration to try to get better research in regards to this and get more comprehensive research